The reason we're getting together today is to talk about SM and autism.
Mhm.
And it's a really important topic because there's a lot of misconception out there, misunderstanding out there. And hopefully, between the two of us, with your so many years of experience and my so many years of experience, and interacting and working with families with SM and autism, the misdiagnosis on both ends, it's critical for our listeners because there's so many listeners out there that are questioning and they're not sure and they're being told different things by different clinicians or educators. And I'm hoping we can kind of get it straight and kind of discuss and open up dialogue for even future discussions on autism and SM. So I guess to me, like one of the first questions we had is why do we want to talk about this today? And I guess I just answered that.
Yes, you did. And I think that
Any thoughts?
you have experience with patients that came to you with a diagnosis of autism, then you found out they had only SM. Same with me, or they came for SM, we find out they have autism, and the SM is mild or it was misdiagnosed. And then there are children who have both. So that's something that we know that is possible. And in the past, the same as we couldn't diagnose autism with ADHD, and now we can. We also are doing in our field of SM, we are realizing, and we have realized for a while already, but I think it's being more accepted that they can coexist, and but we have to differentiate to see if they're
Yes.
both together or each of them separately. So,
No, excellent, excellent points. And I want to say I always felt a bit of a trailblazer with this, and I'll tell you why. Because for so long, I was told the DSM, which is you can go into, we're going to go into that in a little bit, but I just want to intro with this is that SM and autism can't exist together. And that if you have autism, you can't have SM. And if you have SM, and so for so long, I felt like I was like kind of, had a little bit like kind of like looking around the corner going, wait, this is not true. And I am not going to be able to listen to what some of these people are telling me. They're telling me this because they don't understand what SM really is. They're seeing it as kids that speak and don't speak, and that's what they're focusing on. And a
I
lot of the DSM talks about that. But as you know, and you and I were very, very passionate about this from the very beginning, and we connected over the fact that the comorbidities or the whys are
Mhm.
what shape this social communication anxiety that you not speaking again. I say it in every single podcast is a symptom.
Yes.
You
Good.
can have SM and you can have autism.
Yes.
And right?
Yes, I totally 100% agree. We can't deny all the cases that come to our doors that we see that. You and I see a lot of kids with neurodevelopmental disorders, that's part of our practice. And that's why we've been seeing them for many, many years. I started collecting data in 2006 with Dr. Andy Zimmerman, and more recently with Anita Ponjawi. And the way that the reason why I started collecting data is because I had this at my face and I was looking at the DSM and I couldn't really match what I was looking at. And
Exactly.
so that's why, we started getting some data, and you have data, information, scientific data, and there have been some other pieces of research on this topic too, although there has been some resistance in acknowledging this. I just want to say that you said about the DSM, and I'm going to, mention the DSM-5R, which in the case of SM, it says that it can be attributed exclusively to ASD or to a speech and language disorder or something like that. So I would take this exclusively as the word to include, it's not due exclusively to ASD, but it can coexist. And in the ASM, that's the ASM. And in the ASD, we can go over that afterwards in terms of the diagnosis, because what would differentiate the two is really important for us to look at that, the DSM, but also levels of impairment in the repetitive behaviors and the obsessive and compulsive tendencies for autism. So
Yes, and I would say just to kind of put in there before we kind of look at a little bit of research to give families some information, listeners,
Yeah.
professionals listening to this, is that one of the biggest things I see, and again, I think I'll reiterate this as we move along in this podcast, is the social puzzle, the know how, a really tremendous differentiation between having SM only. Well, I don't want to say SM only because SM to me is a symptom. And
Right.
having the social communication anxiety without ASD, how about that? Is that most of those individuals understand the social puzzle. Their anxiety from other reasons impact them from having maybe a social connection, communication, interaction in settings that create anxiety for a variety of reasons. But those with autism, whether they have SM or they don't, it's the social puzzle. It's
Mhm.
the difficulty figuring out the social nuances. And I see this over and over, Vera, in my practice, where families come thinking for many, many years, this is SM. I would say on a weekly basis, I come in contact with a family of a teenager who has been diagnosed with SM. And as I'm working with them and assessing them, I'm like, whoa, yes, this child has SM symptoms, but guess what? They're on the spectrum. They have so many symptoms, and that social puzzle they cannot figure out that causes them avoidance, stress. And as a result, it frustrates parents because they just don't get why their child doesn't understand the social puzzle, or they don't even realize that. They just think it's not speaking. So they may work with somebody that's about speaking, trying to get them to speak, and the anxiety that goes up and the frustration that occurs along the parents' experience, the child's experience, avoidance, if they're aware of that, is just tremendous. And
Yes.
then having those difficult conversations with families when you see autism. Imagine this happened to me 2 weeks ago, a 19-year-old been funneled for years into SM only, social anxiety, classic autism, classic. How it was missed from treatment, I don't know. We ended up doing testing, and yes, this individual, 19 years, and to have that difficult conversation. So I just wanted to put that out there because I do believe we have listeners that are on the fence. Does my child have autism, SM only? Like, what's going on? So, yes, there's a lot of misunderstanding.
Yeah,
So,
I agree with you. I think that I too get cases that come with the diagnosis for a long time, and of course, the later, the more difficult it is for us to treat a teenager versus a child. I think that the key here is to do a very comprehensive assessment, as you said, and I think that the we when we have little kids, we can watch the child as the child relates to the parents at home. And also I ask parents to bring me videos of when they were babies, to see the shared attention, to see the eye contact. This is for more severe cases of ASD, which we can see more clearly. The most difficult one is to differentiate or to diagnose the ASD level 1, the highest level of functioning of ASD, when we have SM, because the pure definition of selective mutism are children who do not speak in certain places, but they, with some people when required, as opposed to speaking regularly at home with their parents and with other people they feel comfortable. So I really like to include videos from home so that I can see the natural relationship and the natural social exchange and taking turns and theory of mind, like you said, the social cues in video, because quite frequently we hear that no, they're fine at home, we speak fine at home, but they really are not. They have a one word sentence, or they don't have the eye contact, they don't have the empathy, which is really important for teenagers and young adults for us to ask, and older children school age. But I think that it's really important to do a good assessment. Developmental history is really important, and to
it,
see the show the signs early on. But again, we are finding out more and more that the more autism is being diagnosed, not because there is an epidemic, but because there is a higher sensitivity for it and more information and knowledge about it. So it's the mild and the level 1 type of autism that is really what we're dealing with here, that is more difficult to differentiate from SM or to see if it's there co-occurring. And the best way to diagnose is to use scales, to use the scales that are really good with autism, like you use the others. And I use some questionnaires that actually do not help much in terms of differentiating, because a lot of the social avoidance, like you said, the social communication avoidance you said, is inflated when we give an autism scale to a child with SM. But we really have tools that we can use, a multi method, and talking to a lot of people, observing at school, observing at home with a video or with Zoom, where you watch the family during a natural kind of interaction. And then you have the tools to differentiate the two. I have other items that I can mention afterwards to you. There's some of the things that we look at, but I really like the fact that you focus on the social cues, theory of mind, and shared attention and other areas that.
You brought up a couple really good points. One of the things that happens at the center is we'll get calls with, my child has SM, I just want to get treated. What do we do? And it's like, whoa, 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 stop, step back. So this is why for us, the selective mutism evaluation, which is an hour and a half evaluation, some pre-forms for families and schools to fill out. And then we meet with this family and this child, teen, or adult to be able to do a assessment to determine what are those whys, comorbidities, some of the other coexisting challenges, toileting, eating behaviors, sleeping issues, and et cetera, and their baseline stages of social communication, which we use the SCI, the Social Communication Anxiety Inventory. And what we do is we get a kind of a clinical picture of what that individual is and what we need to address in treatment. So to be able to walk into a therapist office and just start treating SM, quote unquote, I don't know how that can be successful with so many, because you're missing those comorbidities, those whys that have to be addressed. And also with autism, what is this child like at home? What are they like out and about? And
Yeah.
that's a really important question that we need to figure that out. And through the questions asked, you learn with individuals with autism that their language impairment, some of their motor difficulties, some of the sensory processing that
Yes.
is more exaggerated. They're like the same in setting to setting. Their speech may be the same in setting to setting. So yes, they may be not verbal and they may not be expressive, initiative, and elaborative, but as you said, they're not doing that at home either.
Yes.
So you have to determine, is there a change in social situations to make that SM diagnosis? But to me, for any of our listeners that are going to clinicians for evaluations and treatment, I'm hoping that they're doing a comprehensive evaluation to be able to at least screen for these difficulties instead of jumping in and trying to give them brave points to talk if
Yeah.
they're not yet ready to do that.